right, thank you for joining us. This is the second episode of Premed Life podcast. We welcome you all. Today in our midst, we have the honors to introduce Dr. Samuel Ayala, and he is an emergency medicine physician, New York, and he has over 12 years of experience in the medical field. He graduated from University of Massachusetts School of Medicine in 2009. And had his residency in emergency medicine from Albert Einstein College of Medicine. He's currently affiliated with NewYork-Presbyterian, Brooklyn Methodist Hospital. Dr. Ayala, thank you for taking time out of your busy day to speak with us today.
Absolutely. Yeah, my pleasure. Thank you for having me before.
Thank you so much. We really appreciate it. Actually, I actually forgot to say that he's actually also a faculty member at Weill Cornell School of Medicine.
Yep.
Cool stuff. Yeah, pretty cool stuff. Thank you so much, Dr. Ayala. So, I mean, my first question for you, for all the guests that I host, Dr. Ayala, my first question to them is always about what their story into medicine is. And so I will throw that ball right into your court. What is the genesis of your medical journey and of your story?
Well, you want to know when I was born first, or what do you want? So it all starts one cold night. No, I'm joking. I'm messing with you. My journey to medical school. So, honestly speaking, my interest in medicine all started when I was younger. I don't have much precedence before me. And I grew up in a very humble background of, my father was the son of a farmer, the son of 9 children.
Wow.
And my mom was, the fourth of 8 children. And she was the daughter of a blue-collar worker / handyman. So there was not much precedent before me. Nobody went to a 4-year college. The only one who went to college was my mother, who actually is a nurse. She went to nursing, got her associates in nursing. Actually, the year I was born, I was in her belly, almost getting ready to be popped out when she ended up taking her nursing boards. So,
wow.
I guess that's the start right there. I guess I would listen in on her nursing classes when I was inside her belly.
Right.
That's the real genesis right there. Yeah. No, I have to be honest with you. That's it right there. Right. And growing up, I always had a keen interest in sciences, memorization. I was really, really good at it. Somewhat of a little bit of a nerd, like all talented and career-oriented people. Read a lot of books, and eventually in high school getting into sports, did both of them at the same time. Reading, sports, became a student athlete where I grew up in Springfield, Massachusetts. But yeah, my mom's influence, visiting her at work. She, for almost 40 years, was a obstetric nurse in Bay State Medical Center in Springfield, Massachusetts. And, we'd go visit her. She would introduce me to some of the doctors there. Thought it was kind of cool what they did. And as I would myself go to my pediatric visits, when I would see the pediatrician, was always interested in what they do. And I thought it'd be really cool and, quite an honor to do something like medicine. So, I took off, realized that I had to work hard, did well in middle school, high school. Like I said, a student athlete. I was captain of football and wrestling team. I was valedictorian of my high school in Springfield, Massachusetts. And that was probably of a graduating class of about 410. So valedictorian. And I was lucky enough with the way I worked so hard to attend Brown University. So I went to Brown University undergrad. There knew I wanted, to head toward my pre-med sciences, but also still having the ability of having a liberal education. and Brown University was a good spot for it. Graduate from Brown, took a year off, worked in a clinical laboratory, and in that year off applied to medical school. And I was lucky enough to get into medical school at University of Massachusetts in 2005. So that was that's my life in a nutshell up until medical school. And I'm sure you have more questions to ask. But yeah. I mean, again, like I said, and not much precedence other than my mom, a very powerful woman. I was raised by a powerful woman who had a big voice. She was the middle, basically the middle of the pack in her family, but one of the most powerful in her family because she was loudmouthed and very aggressive with what she wanted in life.
Right.
She went to educate herself, knew that she needed to take care of her children, and the way she needed to do that was by educating herself and getting a real job, which is nursing. So very humble background, and with that precedence, she's the one that helped inspire me. She's one of my heroes, my mother.
Right. That is such an inspiring story. Thank you for sharing that.
Yeah. Thank you.
So we hear about emergency medicine physicians all the time. Like, who really are these heroes? I mean, like, okay, sure, like all doctors are heroes, but your job has like a bit of like vehemence to it. It's more like a kind of intensity to it, like no other. So can you give us a description of what emergency medicine is all about, and perhaps give us a gist of how our typical day looks like for you, and how your weekly schedule normally looks like?
Sure. I mean, great question. Thank you for asking. The typical emergency medicine people have, all the flashy lights and the highlights of watching, the program ER in the 90s or in the late 2000s. They think about, the show with paramedics and picking up people off the street and trauma and gunshots. And honestly, we see a lot of that. When I was in medical school, before medical school, and when I was in medical school, I used to love watching those shows. Now I'm tired of it because I live it every day. I prefer not to.
Right.
Yeah. I prefer to watch just like Family Guy or South Park or something like that. But honestly speaking, the life of an emergency medicine doctor, people think about the glitz and glamour. It's not all that. We do take care of a lot of patients that come through the ER and come through the ambulance bay. I like to think about it as controlled chaos. We know how to manage that. We're trained to actually do that, which prevents our burnout. They always think about, back in the day, people that were grandfathered into emergency medicine. I'm not sure if you know, but emergency medicine is one of the newest specialties, roughly about the late 60s to 70s. The newest specialties in medicine in whole. And a lot of people grandfathered in and they burnt out. But here with our new training, we don't burn out. We burn out a lot less. We see a lot of undifferentiated patients that walk through the door, some well, some not well at all. And it's our job to develop a sixth sense, all right? Whether it's our eyes, ears, smell, our touch, just not taste. We don't really taste many things, all right, in medicine as far as disease. But it's our job to have that sixth sense and to realize who's sick and who's not sick. All right. It's something we take a lot of pride in. People say, emergency medicine is not a real field. We're not real specialists. We are specialists. We're the specialists of making sure that we rule out anything that's going to kill someone. So I take a lot of pride in that. Do we do a lot of primary care as well? Absolutely. We are the safety net of people that don't have insurance, of people that are immigrants, of people that are in their worst luck, of people that are picked up off the street. We are the first line of defense, and I take a lot of pride in that, being able to treat and see all those types of patients, whether they're male, female, different socioeconomic status, whether they have different sexual orientation, whether they're immigrant status. I take a lot of pride in that. And I myself, I mean, other people may beg to differ, but I myself don't care whether or not they pay me in that moment. The hospital will figure it out later, but I myself want to make sure that they're not dying in front of me.
Right.
Yep. So typical day for me, it's a little bit special because of the fact that I am an academic I do a lot of teaching as well, but a typical clinical day usually starts off a little slow, and then we get a little bit of a rush around noon, lunchtime, slows down a smidge, and then we get a huge rush right before dinner. Where we're seeing a mix of patients. I mean, just yesterday, I wasn't even in the most acute area, but yesterday I saw older Russian lady who broke her arm, a young woman who had a red eye, and I had to act like an emergency ophthalmologist. Saw abdominal pain. Saw someone with an abscess on their buttocks. You see GYN complaints, a little bit of a trauma, chest pain, and even a demented man who has cellulitis. And even a little old lady from Jamaica, who 90 years old, coming in with, a urinary complaint. That's not even the most acute area. On a day where I'm in the acute area, where I'm actually working with residents, I'll see, especially the summertime, which gets a lot busier with trauma. I'll see a gunshot wound, a stabbing, somebody who fell off their Rebel scooter or their city bike, somebody who was hit on their city bike, somebody who's fallen off scaffolding, somebody who comes in with a heart attack or a heart failure. All right, or even a young woman with a ruptured tubal pregnancy. This is the gamut of what we see, and I work with residents and train them and try to deal with that and help those kind of patients. So that's on a typical clinical day. Would last about 12 hours. On a non-clinical day where I'm mostly teaching, it can range anywhere from giving lectures, to residents, medical students, to training fellows in ultrasound, which is one of my specialties other than medical education, training fellows in emergency ultrasound to learn how to use the ultrasound machine to make clinical diagnoses. So it goes back and forth. I am fortunate enough to have protected time with my institution to do both of those. And they count on me, and I count on them to support me in that manner. That's what keeps me sane and keeps me from burning out.
Right. I was just gonna ask,
to do those.
How do you manage all of this and not burn out? That was what I was gonna ask next. Yeah.
It's tough. Early in your career, you feel it. Especially when you have loans and you're trying to pay off stuff, and you have wife and children and trying to get a house and all that stuff. It's hard. All right, but you have to make a little bit of time for yourself, what we call wellness.
Right.
All right, and that's one of the biggest things that they talk about in emergency medicine and medicine in general, but especially emergency medicine, just because there's such hustle and bustle, and it's a huge sprint. All right, for that day that you're there, and sometimes it's a couple days in a row like that. But you have to make time for yourself and make time for your family.
Right.
Not easy early in your career, but once you're get past those like 5, 6, 7 years, it's a little bit better.
Right. So in about, let's say, 3 adjectives, how will you? What are some qualities that you will describe an emergency medicine physician to having, or yeah?
3 qualities, adjectives.
Yeah.
You have to be flexible. All right. Nothing's gonna be perfect. Nothing's gonna be wrapped in a nice a bow tie, a present right in front of you. Nothing's gonna be set up nicely, all right, with lined pen and paper. You have to be flexible, all right, and be aware to roll with the punches, whether it's a change in the patient's mental status or their clinical status, or a change in going from a slow day to all of a sudden getting a rush of 10 patients. Whether they're sick medically or a school bus accident, you gotta be quick with it, and roll with it. All right, because it's not going to be perfect, and you got to know how to deal with all the complaints from head to toe. because we know a little bit about everything.
Right.
So one, flexible. Number two, you have to be humble. All right, humility. You're not going to know everything. There are going to be things that you don't see. Not every patient reads the book. So you're not going to have the prototypical case of somebody who has a heart attack. All right, they're all a little different.
Right.
All right, it's more common to have uncommon cases of common diseases than common cases of uncommon diseases, if you know what I mean.
Wow. Yeah.
All right, yeah.
Yeah.
So not everybody reads the book. So all right, more common that they're different. All right, but you gotta you with experience and time, you know what things to look for. All right, what dangerous objective findings such as vital signs and how a patient is, and you use a little bit of your experience, but a little bit of also gambling. All right, because you have to use an educated guess of whether or not you're going to do more or keep someone in the hospital versus discharge them.
Right.
So humility, and the last thing, I would say respect. All right, for all different nationalities and religions, races, creeds. All right, because everybody is the same on the inside. All right, I don't care what color you are, what you believe in, they're all the same, and everybody deserves to live. All right, no matter what kind of diseases are out there, whether it's a physical disease, a mental disease, a social disease, they all deserve to live. So you have to have respect, all right, for those people and treat everyone the same. So emergency medicine is great in that manner because, you know, I grew up, you know, in a very humble background, like I told you before, and you know, we grew up poor. We grew up in a mixed background. My background is actually Puerto Rican from my father's side and Polish and Italian from my mother's side. And you know, I even have extended relatives who are African American and Korean and, you know, Native American, Indian, you know, all that stuff. All right. So I grew up in such a varied background, so we have to have respect for each other.
Right.
Yep. Right. So those two things.
Thank you so much for sharing that. And so just a quick introduction. How many years does it take or did it take you to become an emergency medicine physician? How many years does it take?
Yeah. So generally speaking, you know, to get into medical school, you need 4 years of undergrad. Some people opt to go straight through to medical school. I always recommend at least a year off. It helps mature you, helps you get into the workforce a little bit, pay off bills from undergrad, you know, maybe see the world. All right. So I took a year off. So not including that year, it was 4 years undergrad, 4 years of medical school, which if you break down those 4 years of medical school, they're roughly, you know, most schools are roughly 2 years in class learning and 2 years out of class learning, meaning clinical. So that's 8 years. And then if you look around the country, most emergency medicine residencies are 3 years, which includes a 1 year, first year, what we call an intern year. All right, it's that intern year, the prototypical intern year that most residencies have. So 3 year emergency medicine programs are 3 years. I just happen to have you know, the rarer ones that's about 10 to 15. There's maybe 10 to 15% of the country still has 4-year programs, which kind of a little older school. So that 4 year, I did 4 years of emergency medicine. With that last year, I used to better myself as a pretend attending, meaning practicing attending. And I also used that last year to become a chief resident. So I was one of the chief residents at Jacobi. All right, which I worked on administrative capabilities, teaching capabilities, you know, job searching, exploring myself in other venues and avenues.
Nice.
So 4 undergrad, 4 medical school, 4 emergency medicine resident. After that, you can be a straight up either you're doing 3 or 4 years. After that, you can be a straight up emergency medicine attending. I myself did 1 extra year just for the hell of it. Not really. I did 1 extra year to become an ultrasound fellow and better my skills in emergency ultrasound. So that was 4, 4, 12, 13 years of schooling
Right.
or training.
Right.
And I finished that at the end of the middle of 2014. So have been a full-fledged attending since 2014 till today.
Nice, very nice. Yeah, and when we talk about for our listeners, when we talk about specialties and subspecialties, what's that all about? Can you clarify that for us, just for our listeners?
Sure. So you go into emergency medicine, or let's say any other medical fields, internal medicine, surgery. There's usually that basic training, and they all have different numbers of years of residency. But each specialty, meaning emergency medicine, surgery, has a smaller component in which you can get extra training in, all right, to care for a specific subset of that population or those type of patients. So, case in point, medicine, or you can do an internal medicine residency, and then people that want to get into cardiology, pulmonary critical care, rheumatology, gastroenterology, they have to do extra training, and they're all a different number of years. In pediatrics, same thing. You can do endocrinology, pulmonary critical care, neuropediatrics, all different. Surgery, same thing. All right, things such as plastic, cardiothoracics, minimally invasive. In emergency medicine, the subspecialties are not all inclusive, but we have pediatric emergency medicine, ultrasound emergency medicine. We have disaster, all right, where you can respond to disasters, and pre-hospital care emergency medicine. You have toxicology. You have pain management, sports medicine. You have international emergency medicine. It goes on. There's a couple more that I'm probably missing, but I can't think of them off the top of my head. And they all have different number of years.
I see. Right. Yeah. Thank you for breaking down that for us. Now, some people, Dr. Ayala, some people fall into the trap of wanting to go into medicine for the wrong reasons. And one of such reasons, or one of such wrong reasons, include making huge sums of money. The assumption, and making that one sole goal. Why is that not a good motivation to go into medicine, in your view, and taking into account your experience so far in the field?
Yeah, I mean, well, the biggest thing you have to look at is our generation now is, gain some debt. All right, we, unlike our previous generations, education has become more expensive. Schools have started to charge more. There are even some schools, especially medical schools, that are for profit, and they are a little easier to get into. They give great opportunities for really, really great students that just don't happen to test well to get into their school, but those students will still have to work very hard, and the school is more expensive. So one of the, if you're thinking that you're going to make a lot of money, just be aware, if you don't already have medical school and your undergraduate paid for, you're going to be paying off some debt. Now, the great thing is you're going to be comfortable in X number of years, let's say 15 to 20 years, you'll pay off that medical school debt. You're going to be working hard, but paying it off and still have a comfortable living. Now, you can go into lucrative fields such as neurosurgery, cardiology, plastic surgery, make a good amount of money, but you're going to be working really, really hard. All right. So if you want that money, great. Find yourself really working hard. You may sacrifice a lot of your wellness, a lot of your ability to take care of yourself, your personal, health, and also whatever your family needs are. And unless you can really balance at that time, don't think that this money is really worth it, because money is not everything. All right. For me, myself, the only thing I need money for is just ultimately to pay my mortgage, make sure my son gets into college and that he's comfortable, doesn't have to worry about any of those expenses that I have to worry about. And then every once in a while, have a nice vacation for myself. Other than that, I care less what clothes I'm wearing, what shoes I'm wearing. Back in the day, my mom used to, spend those $100, $110, $120 on my my Nike shoes. Now I buy sneakers that are about $40.
Nice.
You know,
Yeah.
the only other shoes that I buy are a little bit expensive is my work shoes, which are from Clark's, only because I want to have comfortable feet.
Right.
But I wear those down to the bone, man. I wear those down to the
Yeah.
sole.
Yeah.
I get use of them. Sometimes they have holes in the bottom. Yeah, they
Oh,
do. They
man.
do.
No,
I really care
yeah.
less about what I wear.
Right.
I mean, I do love vacations because those are memories and those are relaxation that I can enjoy.
Absolutely.
But yeah, if you go into medicine just for the money, find yourself working really super hard unless you're really lucky, some sort of concierge medicine. All right. Or I would just decide to go into business. But FY, that's pretty cutthroat to begin with. It can be unpredictable too.
Right. And so thank you for sharing that. Now, what are some challenges in the medical field, and on a more personal basis? Like, what are some of the challenges like that you face as an emergency medicine physician in your daily work process and like in your daily activities?
Yeah. Well, I'm gonna come back with first of all the benefits. All right, of my daily of what I do every day. The benefits are take care of a lot of people, help a lot of people. They may not come back, all right, to emergency medicine, but you see them for a quick visit. You help them heal their ailments or their problem, all right, and then they can follow up. You meet a lot of great people too. As people that, just a young guy off the street may not realize that he's a pretty educated guy, or an older man who just so happened to be in a bed. You don't realize that he's a famous scientist that invented some sort of medicine that you use every day. I mean, this happens. So the benefits are you see a lot of people, meet a lot of great people, work in great teams. Those are benefits. The easy part is actually the medicine. Thinking, trying to make the diagnosis, that's easy. I mean, are you going to get 100%? Hell no way. Nobody's perfect, all right? And then so humility. So, but that's the easy part, thinking about the medicine. The hard part, all right, is the politics. There are politics in the hospital system. It is, medicine makes money. Right, so the people that are the head of it, they have to make sure that profits keep on coming in, unless you work primarily for a public hospital. So policies can be big, which includes things such as seeing enough patients, making sure there's a specific time frame in which you're seeing the patients, making sure the documenting is in place, and that's a huge other I guess negative of the day, having to document, spend lots of hours putting things on paper. And why do you put it on paper? Yeah, to get paid, but also for the legalities. Unfortunately, things do happen, and they're on certain events, and you try to do your best not to get sued, and it still happens. But it does happen, and it's a negative, and it can really make you feel that you're not doing a good job, or that you tried everything for a patient and then you failed.
Right.
So that's a big thing. What is another negative? And even though you have to also respect personalities, there are a lot of personalities that make it very difficult for you to respect. There are people that don't have respect for you. You get a lot of people that either are entitled or a little bit too urban for your good, if you know what I mean.
Yeah.
And they don't realize that they're in a very professional place, and that they need to respect where you are, and respect the fact that there are other people sick where you're working, and they're not the only ones.
Yeah. And do you think there are how should I put this? Any changes that you think will be positive, especially just perhaps in general, medicine in general, but also in an emergency medicine? So some of the problems that you brought up, like what are some changes that you think will be good for the current system that we have?
Yeah. So I mean, even though they're negative things, the changes that happen. So when they require increased documentation, all right, and have you document a certain time you gave this medicine, or a certain time you saw the patient, it's actually better for the patient, it makes you a better doctor. It's better care for the patient. So that's one thing. I think as well, there are certain requirements that the patients, inpatient care that they require, such as making sure you document well. It gives the patient the ability to be in charge of their own care. All right, and get away from that previous paternalistic view of medicine. That's great. What else? I think the COVID pandemic has shown us a lot as far as what this nation is capable of. I think the changes as far as what we had to change, as far as really, realizing what is deemed an emergency, what is not, what can be seen outpatient, what is not. All right, what emergency medicine is about. It was good, and it continues to be good for a little while. But unfortunately, people revert back to their old ways of thinking that the emergency medicine department, can be used for everything. Right. Back when COVID hit, people should have been only coming for being sick with coronavirus or any other emergencies. Mm. All right, so they stopped coming for a little bit. But they're reverting back, and some people have to realize they have to follow up with the primary care doctor, or they need to find a primary care. So that's a little more deeper question and deeper response.
I gotta ask this question. What is your thing with white coats?
Oh, my white coat. Yeah. So you originally before you asked me. That's funny you ask. I have a thing about wet jackets too. And also I also had you address me by my first name too. Yeah. But I mean, physically, white coats are just too hot. I'm a big guy. I did football, wrestling, rugby. I have a lot of muscle and even a little bit of fat on me too. But I generate a lot of heat. So whenever I wear a white jacket and I'm running around the ER trying to, put an IV line, trying to, resuscitate a patient, trying to see a patient on the other side of the ER, I get way too hot. Right. All right. And there are too many bodies in the emergency department. So I have to take off my jacket. Right. Yeah. So when I'm at work, I generally wear slacks, like khakis, right. Some nice Clark shoes, and I wear like a polo. So yeah, I get too hot physically. Also with white jackets, I feel like the same with my name. Generally speaking, I have just people refer to me by my first name. I introduce myself as, my name is Sam. I'm one of the emergency medicine doctors, or my name is Dr. Ayala, but you can call me Sam. And I'm going to be your doctor today. Right. And the way I feel about it, just with, the way I feel about not wearing a white jacket, I'm not all about the title. All right. I have my knowledge. If they trust me and I introduce myself as a doctor and they know that I'm the doctor, the physician, all right, I don't need them to raise up my my level any more than I earned. Right. I earned the title, right? And I feel as though if they're used to more calling me Sam, all right, or a lot of people still feel uncomfortable, so they'll call me Dr. Sam. I feel that though what it does is it shows my humility, and it shows still that I can lower myself to their level, all right, and it allows them to be a little bit more open, all right, for me to communicate with them. Because remember, these patients, I'm meeting a lot for the first. I would say 98% of the patients I meet for the first time that day, and I will never ever see them again. All right, so if I can get them to trust me very quickly in the first 5 minutes of my interaction, then that's a huge portion of my battle. All right, with what is going on.
Thank you for sharing that. All right.
No problem.
I'm gonna ask you, Dr. Ayala, about your general advice for pre-meds out there listening to us today, or people going into healthcare, and for all the future Dr. Ayalas out there, in their pre-med years, getting ready for medical school, and hopefully
Yep.
one day their residency years. What is your advice, and preferably, I guess, like advices that you have for us, especially since you've been through all those stages over the years, and with the experience that you've garnered so far in the process.
Yeah. So, I mean, coming from a very humble background, a mixed background, coming from a background where I primarily identify myself as a minority, it can be tough for, fellow minorities, especially as well if you're a woman, all right, in that minority position, all right. So, my advice for you guys is find people that look like you, all right, and that have the same mindset, all right. Even if you're somebody that is Caucasian, all right, if they have a different mindset than you, all right, it's not going to work. If you have a mindset that is similar and that's open, all right, and they have they can give you some precedence, they can give you some advice. Take it. All right, find yourself a great mentors, keep them, nourish that relationship. All right, take as much advice as you can, and a great mentor will give you advice and will encourage you if you do the opposite.
Mm.
Right, they'll try to guide you the best way, and if you make a mistake, they're going to be there to help you pick you up and to help you learn from that. All right, so one of the biggest advice: grab yourself a great mentor that's similar to you, similar background. If not similar background, somebody that you can identify with, or you can at least learn from that background, and go with it. All right, launch yourself. It is tough. There are not a lot of people that you can look up to. All right, especially if you come from underserved background or whatnot. And even if you don't, that that's fine too. All right, but really learn from that culture and that knowledge base
Right.
that person has to offer you. So that's one thing. The second thing is obviously it's very cliche to study hard, but I can't stress it enough. You have to study hard. A lot of people, do have trouble with taking tests, including myself. I was able to get myself to this point, but you have to study hard. All right. Sacrifice yourself. You complain that, oh, I'm doing this, I'm working too hard. Trust me, you sacrifice now and you'll reap the rewards later. Even if not so much for yourself, but for your children or your family.
Right.
All right. You will reap the rewards. All right. Yeah. And the next thing I would say too, remember those people that have helped you and pay it forward. All right. Hence why I'm doing this now. I mean, I love mentoring young people. All right, including yourself. If I know you have a mentor already. But if anybody that needs my advice, I'm going to give you my 2 cents. You take it as it is, but I'm paying it forward. I don't expect anything in return.
Right.
All right. Nothing, zero cents. The only thing I expect is for you, when you find someone young, such as yourself, someone that needs your help and that wants to learn from you, you pay it forward. All right. And let it keep on going. All right. Let the cycle continue, the good cycle.
Right.
So that's the best advice I can give.
Thank you.
Oh, and the last thing, remember where you come from. I have no problem talking about my background, of being Latino, being from a mixed culture, growing up, a Christian, growing up in a very liberal area, and I have to be open to also new things that I haven't seen. All right, but just remember where you come from. All right, because that's what has raised you and that shaped who you are, what you look like, and who you are.
Remember where you come from. Thank you, Dr. Ayala.
Yeah.
And what are some resource recommendations that you may have for Premed listeners? I mean, whether it's college enrichment programs or perhaps like informational websites that you may want to share with our audience.
Sure. So as you know, I'm one of the medical student directors at my institution. One of the big things you have SAEM, Society Academic Emergency Medicine. They have a lot of resources there for medical students. They have something called CORD, committee of residency directors, not so much for medical students, but more for residents and people that are interested in the academic portion of emergency medicine. And they also have the main governing body of emergency medicine called ACEP, American College of Emergency Physicians. All right. So those are the huge organizations that can give a lot of, I guess, resources to medical students that are in medical school interested in emergency medicine, but people as well that are pre-med interested in potentially emergency medicine in general. All right. Now, if you just want information on medicine, I recommend AAMC, which is just before medicine in general.
Right.
Yep.
Right. Thank you so much.
Or AMA. Yep. American Medicine.
Okay. For sure, guys. We will link. Well, we will make sure that we link all those recommendations and information websites that Dr. Ayala just mentioned below.
Yep.
So check it out.
And please make sure to let your listeners know what my email is. All right. You can give them either my Yahoo one or my NYP one. I'm more than happy to answer any questions.
Sure. Thank you so much. And guys, I'll put that in the description as well. So check that below when we're done. Thank you so much.
And if you want to invite me to any of the colleges too, I'm more than happy to speak.
Absolutely. Guys, join me to say a big thank you to Dr. Ayala. I mean, just the sole information and depth of knowledge. Thank you so much, Dr. Ayala. But before I let you go, what are your social media handles so that our students can follow you?
Oh man, I honestly I'm only on Facebook.
Okay.
just because I graduated from Brown University, and of the original Facebook colleges, we were one of the first.
Wow.
So I've been on Facebook since 2000 and I want to say 2003.
Yeah.
2003, 2004.
Yeah.
Yep. I've had a Facebook account.
Yeah,
I think I have a Twitter account, but I don't really follow it.
Okay.
And I think I just joined Instagram, but again, I don't follow it. So just email me. Yeah, I'm a little old school.
For sure, guys. I will link Dr. Ayala's email down in the description. Thank you so much, Dr. Ayala. All right, guys. And so until we meet next time, we'll see you all on the next episode. Bye for now.